5 years ago, I had troubles with the bottom jaw, and I decided that I'd go to a dental surgeon and see if there was anything I could do with implants. They said that they could do implants, although I had a very thin bottom jaw and I needed 2 implants in the bottom. But I decided to go ahead. However, over a period of 18 months, everything was fine, but then the implants started to come loose and infection got round the implants themselves. So their opinion was then that I needed to have the implants removed. So they removed the implants, and they obviously did that free of charge, which was fine, and then I was going to be put forward once everything had healed up for a set of dentures, which I felt was inevitable. The implants hadn't worked, so I would say you need to really make sure implants are what you need and that they are going to last, because obviously they don't always, in my case, because of a thin jawline or thin bone. So I had a new denture fitted, which at the time it seemed to fit quite well and everything worked fine, but subsequently found that denture had actually changed my bite, but I didn't know this at the time, and consequently I started to get some of the bottom teeth started to get loose that were left in my lower jaw, and it meant that I'd have to probably have some more teeth taken out to get the denture to fit properly and have a new denture made. So I went back to the surgery I used before, but only to be told that the person who'd done the work on my teeth before had now left the company, and I'd have to have a reassessment, which I'd have to pay for, which I thought was not very good, because obviously I'd already paid for assessments at the start and they had all my records. So I thought, they should be able to work on me without going any further. Anyway, I would have made an appointment, but they said there was a 3-month wait, besides the fact that I had to put a few £100 up front for the examination and before I could have the work done. We were due to go on holiday, so I thought I'd better try and see if there's somebody else who can fix me up with a better denture. So I looked around and found Rytec. Now I went to see Rytec about what could be done, and they looked at my teeth and looked at the implant I had, and I also had a loose tooth, and they recommended I go to one of their recommended dentists, who looked at it and managed to say, yeah, that needs to come out and the rest will be okay. So I had the tooth removed, which was a normal extraction cost, which was very good, and the rest of my teeth were sound. So I then went back to Rytec and was fitted with, or the denture I had was looked at and found that my bite was completely wrong, and that they could do something temporary for me so I could go on holiday and be able to eat properly, but that when I came back after my holiday I was to come in and fit a new denture, which I subsequently had done, and it changed my bite totally. I was actually grinding the back of my front upper teeth away, and this was shown to me when I went to the other dentist. He said when he extracted the tooth that it had actually done some damage to my top teeth and I needed to get it sorted. Rytec then made me a new one, which I've got fitted now, and it's absolutely splendid. It does everything it should do, fits nicely. I don't even know I've got it in when it's in, and it's made my bite so much better. And the difference now that I've had the new denture fitted is the fact that I can chew properly. My digestion's a lot better, and I'm actually chewing now as I should be, and it's not wearing out my top set of teeth. So I'm very grateful that we've got that sorted out. So I've had the denture in now for just over a year, and I'm back today just to get a little bit of realignment done, because I've got, obviously, as I get older, the bone loss continues, and it just needs a slight bit of padding to build the denture back up so that I'm chewing properly again. And I come back and it's done straight away, aftercare, and any problems just give a ring and I'm fitted in to get it sorted. So it's really good.